Welcome learners. Today it's our fourth lecture of Nebosh IGC free training. In this lecture, I will address the health and safety governance, roles and responsibilities in organizational structure. I hope you will enjoy this learning activity. The title for today's training is Health and Safety Governance, Roles and Responsibilities in Organizational Structure. For today's, the training brief of this lecture is, first, this training provides a comprehensive understanding of the roles and responsibilities within an organizational structure for effective management of the workplace health and safety. Then participants will gain insights into the importance of establishing clear governance frameworks and structures to ensure compliance with health and safety regulations, as well as fostering a culture of safety within the organization. Through practical examples, participants will learn how to define roles, allocate responsibilities, and establish accountability mechanisms to effectively manage health and safety risks. So for today's lecture, we have following learning objectives. Number one, identify the ultimate responsibility for ensuring workplace safety and the obligation of the employer to maintain a safe and healthy work environment. Number two, understand the responsibility of employers to ensure the health and safety of individuals who may be affected by their work activities, including employees, visitors, and members of the public. Number three, recognize the importance of providing competent health and safety advisors within an organization and the role they play in supporting effective health and safety management. Number four, recognize the role of the directors and senior managers in setting health and safety policies, allocating resources, and demonstrating clear commitment and leadership in ensuring workplace health and safety. Number five objective is understand the responsibilities of the middle managers and supervisors in maintaining health and safety standards within their operational areas and ensuring compliance with legal requirements. Number six, recognize the shared responsibilities of joint occupiers of the premises in ensuring health and safety standards and understand the need for cooperation and coordination between employers in shared workplaces. Number seven, understand the importance of the effective contractor management in maintaining health and safety standards within the workplace and recognize the shared responsibilities of clients and contractors in ensuring a safe work. The ultimate responsibility for ensuring workplace safety and the obligation to maintain a safe and healthy work environment lies with the employer. The employer, typically an organization such as a company, is responsible for ensuring that the workplace is safe and free of health risks. This duty is clearly stated in international standards such as the ILO Conventions C-155 and Recommendations R-164, which are usually reflected in local laws. The employer owes a duty to their own workers, employees, to ensure their health and safety, as well as to other workers who may be working within their workplace but are not direct employees, such as casual workers, agency workers, and contractors. Additionally, the employer has a duty to workers who are not their employees but are carrying out work on their behalf, such as contractors working at someone else's premises on behalf of the employer. Coming on to the next objective, The responsibility of employer is to ensure the health and safety of not only their employees, but also their individuals who may be affected by their work activities. This includes visitors to the workplace and members of the public who may be impacted by the employer's work. Employers have a duty to provide a safe and healthy work environment for all individuals who may come into contact with their operations. This responsibility extends beyond their own employees and encompasses a broader scope of individuals who may be affected by their work activities. Now, we will recognize the importance of providing competent health and safety advisors within an organization and the role they play in supporting effective health and safety management. Basically, the significance of having competent health and safety individuals or advisors within an organization. Competent health and safety advisors play a crucial role in supporting effective health and safety management. They provide expertise and guidance in identifying and assessing workplace hazards, developing and implementing control measures, and ensuring compliance with health and safety regulations. These advisors help organizations establish and maintain a safe and healthy work environment by providing advice, training, and support to management, supervisors, and employees. Their knowledge and skills contribute to the effective management of health and safety risks, the prevention of the accidents and incidents, and the promotion of a positive safety culture within the organizations. Coming on to the next objective, now we recognize the role of directors and senior managers. Actually, directors and senior managers play a role in ensuring workplace health and safety. Directors and senior managers have the responsibility of setting health and safety policies within the organization. They are responsible for establishing the framework and guidelines that outline the organization's commitment to health and safety. This includes allocating resources such as funding and personnel to establish, implement, and maintain the health and safety management system. Furthermore, directors and senior managers are expected to demonstrate clear commitment and leadership in promoting workplace health and safety. This involves actively championing health and safety at the board level and ensuring that the organization's health and safety objectives are achieved. Their leadership and commitment set the tone for the entire organization and influence the attitudes and behaviors of employees toward health and safety. By providing clear direction and support, directors and senior managers contribute to creating a culture of safety within the organization. Now we talk about the responsibilities of the middle managers and supervisors. There is also a hierarchy of organizational structure. So middle managers play a vital role in organization. Middle managers and supervisors play a critical role in maintaining health and safety standards within their operational areas and ensuring compliance with legal requirements. Middle managers and supervisors are responsible for maintaining health and safety standards within their operational areas and ensuring compliance with legal requirements. They are involved in day-to-day operational running of the organizations and are responsible for the health and safety standards within the operations under their control. This includes executing the health and safety policy of their organizations operationally, ensuring that the part of the organization under their control is safe and free of health risks, and ensuring that risk assessments are carried out and method statements are developed for work so that the work is properly planned and coordinated. Middle managers and supervisors must also ensure that their employees are trained and competent to carry out their work safely and that they are provided with the necessary equipment and protective clothing to carry out their work safely. They must also ensure that any accidents or incidents are reported and investigated, and that corrective actions are taken to prevent recurrences. In addition, when two or more employers share a workplace, middle managers and supervisors must cooperate and coordinate their activities to ensure good health and safety standards. They must also ensure that contractors are managed correctly, demonstrating the organization's health and safety responsibility to third parties. Coming on to the next objective, the shared responsibilities. The shared responsibilities of joint occupiers of premises is ensuring health and safety standards are to cooperate and coordinate their activities to ensure good health and safety standards. When two or more employers share a workplace, the risks that one employer creates in that workplace may affect the employees of the other employer. Therefore, both employers must cooperate and coordinate their activities to ensure good health and safety standards. This is set out in ILO C155 Article 17 and ILO R164 Recommendation 11, which state that whenever two or more undertakings engage in activities simultaneously at one workplace, they shall collaborate in applying the requirements of this convention and should collaborate in applying the provisions regarding occupational safety and health and the working environment. Without prejudice to the responsibility of each undertaking for the health and safety of its employees, in shared workplaces, joint occupiers of the premises must also ensure that they communicate effectively with each other to identify and manage any risks that may arise from their activities. They must also ensure that they share information about the risks and precautions appropriate to the building as a whole. The joint occupiers of the premises must cooperate and coordinate their activities to ensure good health and safety standards in shared workplaces. They must also communicate effectively with each other to identify and manage any risks that may arise from their activities. Now, we discuss the learning objective number 7, and in this we will discuss the contractor management. So, who is a contractor? First, we define the contractor. A contractor is a person or organization that is engaged in undertaking of certain work on behalf of a client, but not under the client's direct supervision and control. Contractors can be companies providing contract services or individual workers who work to provide those services. They are often engaged by clients to deliver specific projects, providing specialized skills or deliver additional labor when needed. Contractors may be engaged for one-off service or on a more permanent basis, depending on the nature of the work required. It is important to note that contractors are responsible for their own health and safety as well as the health and safety of others who might be affected by their work activities. Now, coming on to the client. Who is a client? A client is a person or organization who engages a contractor to undertake certain work on their behalf. In the context of the workplace health and safety, a client is an employer who owes a duty to their own workers as well as others who might be affected by their work, including contractors, contract cleaners, other contractors, and visitors to the client's premises. Clients have a responsibility to ensure that contractors are competent and capable of carrying out the work safely and in accordance with health and safety standards. They must also ensure that contractors carry out risk assessments and develop method statements for their work and that they work safely and adhere to agreed methods. Clients must also collaboratively with contractors to ensure that each party does everything reasonable to discharge their duties and avoid criminal liabilities. Now, we discuss the shared responsibilities or duties of the contractors and the client. Shared duties refer to the responsibilities that both clients and contractors have in maintaining health and safety standards in the workplace. Contractors are responsible for their own health and safety as well as the health and safety of the others who might be affected by their work activities, such as the clients, workers, and visitors to the client's premises. Clients, on the other hand, have a responsibility to ensure that contractors are competent and capable of carrying out the work safely and in accordance with health and safety standards. They must also ensure that contractors carry out risk assessments and develop method statements for their work, and that they work safely and adhere to agreed methods. The shared responsibilities between clients and contractors emphasize the importance of the collaborations and cooperation in maintaining a safe work environment. Now, we are going to discuss the management of the contractors, that how a client manages the contractor in his premises or in his workplace. The way that a client manages contractors can be broken down into three key steps: selection of the contractors, planning and coordination of the work, and monitoring and managing the work. So how the selection is important. It is good practice to select a contractors carefully on the basis of their health and safety competence. To help do this, the client can ask to see evidence of the competence, such as a copy of their health and safety policy, examples of the risk assessments and method statements, the qualifications and training records of the staff and membership of a professional organization or certified body, and how the contractor and client plan and coordinate work among each other. The client and contractor must coordinate their work carefully so as not to conflict. The contractors should carry out risk assessments of the work involved and develop safe working methods to control the risks identified. This safe working method must be documented and is often referred to as a method statement. The client should examine these risk assessments and method statements to ensure that there are no obvious problems or errors. The client and contractor must coordinate their work carefully so as not to conflict. There may be several contractors working on site at one time, and the activities of the one person organization must not cause a hazard for another in the areas. After planning and coordination, how the monitoring of the work of the contractor is carried out. Arrangement must be made by the client to ensure the contractor complies with safe working practices. These arrangements should include having a signing in and out procedures, ensuring that the contractor provides a named works supervisors, carrying out site induction training for all contractor workers, and controlling high-risk activities with a permit to work system. The client will need to monitor the contractor's work to ensure that they are working to agreed health and safety standards. If the client identifies that the agreed safe working methods are not being followed, then it is in their best interest to stop the work so that the issue can be addressed. By following these steps, the client can ensure that the contractor is selected, planned, and managed in a manner that prioritizes safety and minimizes risk to workers and others involved in the project. Now, we discuss the procedure for selecting contractors, that how the selection is made at the premises of any client when you engage with some contractors. So there is a stepwise procedure. Number one step is identify the need. Determine the specific work or services that require a contractor. Clearly define the scope of the work, project requirements, and any specific qualifications or certification needed. Then number two is pre-qualification. Develop a pre-qualification process to assess potential contractors' health and safety competence. This can involve requesting information and documentation to evaluate their capabilities, such as health and safety policy. Ask for a copy of the contractor's health and safety policy to assess their commitments to maintaining a safe work environment. Risk assessments and method statements. Request examples of the risk assessments and method statements that demonstrate the contractor's approach to identifying and managing hazards. Then you can ask staff qualifications and training. Inquire about the qualifications and training records of the contractor staff to ensure they have the necessary skills and knowledge to perform the work safely. Then you can ask for professional membership or certification. Check if the contractor is a member of a professional organization or certified body related to their field, as this can indicate their commitment to industry standards. Invitation to tender. If pre-qualification criteria are met, invite selected contractor to submit tenders or proposal for the work. Provide clear instructions on what should be included in the tender, such as pricing, project timeline, and health and safety plans. Evaluate of the tenders. Evaluate the received tenders based on various factors, including price, quality, experience, and health and safety competence. Consider the contractor's track record, references, and their ability to meet project requirements. Selection decision. Based on the evaluation, select the contractors that best meets the project's needs and demonstrate a strong commitment to health and safety. Notify the chosen contractors and inform unsuccessful bidders as well. Then make a contract agreement. Once a contractor is selected, negotiate and finalize the contract agreement. Ensure that the contract includes clear provisions regarding health and safety responsibilities, compliance with regulations, and any specific requirements for the project. It is important to note that the above procedure provides a general framework for selecting contractors based on health and safety competence. The specific steps and requirements may vary depending on the industry, project complexity, and organizational policy. Now, how the planning and coordination among the contractor and the client is being ensured. Planning and coordination of the work involves several key steps to ensure that the work is carried out safely and efficiently. The procedures can be outlined as follows. Exchange of information. First, make exchange of information. The client and contractor should exchange relevant information regarding the hazards and risks associated with the workplace and the work to be performed. The client should inform the contractor about existing hazards, while the contractor should communicate the hazards and risks created by the work. Risk assessment. The contractor should conduct a thorough risk assessment of the work involved. This assessment involves identifying potential hazards, evaluating the associated risks, and developing strategies to control and mitigate those risks. The risk assessment should be documented and reviewed by the client to ensure its adequacy. Method statement. Based on the risk assessment, the contractor should develop a safe working method statement. This document outlines the step-by-step procedures and precautions to be followed during the work to ensure the safety of the workers and others. The client should review the method statement to identify any potential issues or errors before the work commences. Coordinated work. The client and contractor must coordinate their work to avoid conflicts and hazards. If multiple contractors are working on site simultaneously, their activities should be carefully planned to prevent one contractor's work from posing a hazard to others. For example, if one contractor is working at height, it would be sensible to avoid having others working beneath them in that area. Timely submission. The client should request that the contractor submits the risk assessments and method statements well in advance of the work commencing. This allows for a thorough review process and the resolution of any identified problems or conflicts without causing delays to the start of the work. By following these steps, the clients and contractors can ensure that the work is planned and coordinated in a manner that prioritizes safety and minimizes risks to workers and others involved in the project. Now we discuss the monitoring and managing the work. Monitoring is very much important because when contractor perform his work, he may pose different health hazards and safety risks, etc. So to judge, to know the efficiency of the contractors, it is very much important to monitor his work. So how this monitoring is performed? Monitoring and managing the work involves several key steps to ensure that the work is being carried out safely and in accordance with the agreed upon health and safety standards. The procedures can be outlined as follows. So first, you should ensure arrangements for the compliance. The client should make arrangements to ensure that the contractors complies with safe working practices. This includes having a signing in and out procedures, ensuring that the contractor provides a named work supervisors carrying out safe induction training for all contractors workers and controlling high risk activities with a permit to work system. Then the client should monitor the contractor's work to ensure that they are working to agreed health and safety standards. This can be done by monitoring against the risk assessments and method statements that were developed during the planning stage. If the client identifies that the agreed safe working methods are not being followed, then it is their best interest to stop the work so that the issue can be addressed. Then they should work according to the permit system. The client should implement a permit to work system for high risk activities. This system ensures that the work is authorized and the necessary precautions have taken to minimize risks. The permit to work system should be reviewed and updated regularly to ensure its effectiveness. Regular inspection must be ensured. The client should conduct regular inspections of the work site to identify any potential hazards or risks. The inspection should be documented and any identified issues should be addressed promptly. The client and contractor should maintain open communication throughout the project to ensure that any issues or concerns are addressed promptly. The client should provide feedback to the contractors on their performance, and the contractors should provide feedback to the client on any issues or concerns related to the health and safety. So the learners, by following these steps, the clients can ensure that the contractor is working safely and in accordance with the agreed upon health and safety standards. This helps to minimize risks and ensure that the project is completed safely and efficiently. Now, to summarize all this training addresses the role of the different stakeholders in managing workplace health and safety, including employers, employees, and contractors. It highlights the importance of collaboration and coordination among these parties to ensure compliance with health and safety regulations and standards. The training also covers the process of monitoring and managing work, including the selection and management of the contractors as well as the implementation of permit to work system. It emphasizes the need for ongoing monitoring and evaluation to ensure that work is being carried out safely and in accordance with agreed standard. So at the end, you will have an assignment for you as well. This will test your knowledge. This will promote your good thinking about the topic of today's discussion. So I will brief you about the assignments, and when you complete according to the instruction provided at the top of that assignments, I request you all that make a complete plan, report, and then send into the comment box. Thank you and take care.